I am Ananda Basu. I'm a professor of medicine here at UVA, and I am a endocrinologist, and my specialty is diabetes and diabetes management. Okay, that's a great question. You know, I have quite a few family members with diabetes, and as a high school student, I was interested in biology. And then as I was growing up in India many years ago, um, you know, the medical field was really breaking open there, and modern clinical therapy was coming in a big way. And simply because of my passion and the fact that uh, we that I would have the opportunity to help people with diabetes, guided me towards the path of medicine. But really, no medical care or clinical care can advance without research, because without research, the progress will come to a standstill as far as clinical care is concerned. And as we all know, today's research is tomorrow's new drugs and new therapies. Although I realize that research is hard, it takes time, and you have to compete with others to get research funding. But the challenge was attractive to me. And as I mentioned, without any research, progress in medicine will come to a standstill. Today's research is tomorrow's new drug and new medication. So that's the main reason. Basically to, test new techniques and innovate on what we know already about diabetes. So trying to find out, what diabetes does. For example, one of the studies that I'm doing now is to try and find out how we can make people with diabetes fitter and have them exercise and lead a more active and fitter life and improve their general health and not just their blood sugars. So we are starting a new research study where we want to look at specific aspects of exercise in patients with type 1 diabetes. One of the markers of exercise limitation is your blood lactate levels. But we do not know how these lactate levels are regulated in people with diabetes. Getting a better understanding of this would obviously help patients with diabetes exercise safely and more effectively and become better athletes. Another area of research that I'm interested in is to know more about the hormone glucagon, which together with insulin plays a major role in controlling glucose levels in people with diabetes. But we have no idea how much glucagon is made by the human body and how much, what happens with exercise, what happens after meals. So these are the newer aspects of diabetes that I'm researching that so far we don't have the answers. And if they have an opportunity, as high school students or even beyond, to be a member or participate in laboratory-based activity with researchers in and around their locality. For example, for students in Charlottesville, if there are opportunities to work even temporarily in research labs within the university here, that would really help, not only the researchers, but also the students develop more insight into how research is done, what are the methods, and what interests these young researchers. So absolutely participating, active participation, even for a short time, uh, does help to generate interest and to widen the horizons of young students. So any opportunities I would welcome.